Why is bedaquiline drug interaction complex in TB treatment? Imagine trying to juggle multiple balls at once, each representing a different medication. That's what treating drug-resistant tuberculosis with bedaquiline can feel like. Bedaquiline is a powerful drug used to fight tough cases of tuberculosis, but it has a complicated relationship with other medicines. The main reason for this complexity is how it is processed in the body. Bedaquiline is broken down mainly by a liver enzyme called cytochrome P453A4. This enzyme is like a busy worker that handles many drugs, so when other medications are involved, things can get tricky. If a patient is taking a drug that speeds up this enzyme, like rifampicin, it can cause bedaquiline to be broken down faster. This means less of the drug stays in the blood, which can make it less effective at fighting tuberculosis. On the other hand, if a drug slows down the enzyme, bedaquiline can build up to higher levels, increasing the chance of side effects. This delicate balance makes managing drug interactions a real challenge. Many patients with drug-resistant tuberculosis also have HIV. They often take antiretroviral therapy, which can interact with bedaquiline too. Some antiretroviral drugs, like efavirenz, boost the enzyme activity, reducing bedaquiline levels and making it less effective. Others, like lopinavir-ritonavir, inhibit the enzyme, which can cause bedaquiline levels to rise and potentially lead to toxicity. This means doctors need to carefully choose and, sometimes, change these medications to avoid problems. Another important concern is the risk of heart issues. Bedaquiline can cause prolongation of the QT interval, a measure on the electrocardiogram that shows how the heart is beating. When combined with other drugs that also prolong the QT interval, the risk of dangerous heart rhythms increases. This requires careful monitoring with regular ECGs and sometimes adjusting doses or stopping certain drugs. Because of these interactions, doctors must be very cautious when designing treatment plans. They need to monitor liver function and heart health closely and sometimes make difficult choices about which drugs to use together. The limited options for compatible medications make treatment more complex, especially in patients with both tuberculosis and HIV. In summary, the complexity of drug interactions with bedaquiline comes from how it is metabolized by the liver enzyme CYP3A4, its potential to cause heart rhythm problems, and the need for careful, personalized treatment plans. Always remember, managing these interactions requires expert medical guidance. If you or someone you know is undergoing treatment for drug-resistant tuberculosis, it's essential to work closely with healthcare professionals to ensure safe and effective therapy.